One of the things that struck me there that I got to pry into just a little bit more is that idea of both COVID and the vaccine. I understand the pandemic, the stress of that itself, but a viral infection and an immunization can be leading into that. Could you just talk a little bit more on those two? Because I know that's on everyone's mind.
Sure.
I'm either sick with Omicron, like it seems like most of the nation is right now, testing
Yeah.
positive, and I won't go into whether the tests are this or that, but it seems that way. At least they're sick with something. And then there is the other side that is boosting, right? And continuing in
Sure.
Israel, you're on 4 and probably going to continue on like the flu vaccine seasonally. So can you go into
Right.
that and how that's really impacting?
Yeah. I mean, it's really not a surprise to those of us who deal with hair loss that a high fever could cause a shedding, or what we call a telogen effluvium. And in fact, this was noticed back in the Spanish flu. So early in the 1900s, when the Spanish flu was going around, this was the first time that post-febrile alopecia or post-febrile telogen effluvium really popped up in the clinical literature. And it was a pretty accurate description of the symptoms, right? 4 to 6 weeks out from the high fever, patients would have this effluvium of hair. They would lose literally handfuls of hair in many cases, a lot of shedding. Good news is that it was temporary and it seemed to rebound pretty well in the months following. And so we've seen a lot of that with COVID infection, and certainly with the long haulers. Mm-hmm. So, are the long haulers different? Do they have some kind of underlying condition that was maybe not, maybe that was subclinical that we didn't notice ahead of time, and this kind of just exacerbated it? I think that's probably a likely story, that there's some underlying issues with some of these patients. It's certainly the case with a lot of our patients who had kind of been dealing with some maybe seasonal shedding that was kind of mild, but concerning because maybe they had some hair loss in the family. And then boom, they're hit with COVID, and this seasonal shed turns into a massive effluvium and a massive loss of hair mass, where we measure, density and hair caliber and such. And we can track these things over time. So, we've been really dealing with a lot of that. And what I've noticed is that in patients who have had a tendency towards hereditary hair loss, who have maybe been on treatment for some time and really doing okay with their therapies, improving their hair counts and hair caliber and their measurements and so forth, then all of a sudden they get a setback in their numbers appearing in this typical time frame, this 6 to 12 week timeline, and with a visible sign of shedding. And so it's almost like it's an acceleration of that traditional male or female pattern hair loss, the hereditary hair loss, which most of us are susceptible to at least a little bit. Seems to have gotten a lot worse. And then, of course, there's the other category of the autoimmune alopecias. And of course, if you have an autoimmune condition, underlying situation that's affecting your immune system, whether it be a thyroid or your skin or you name it, and then you get hit with the with SARS-CoV-2, that can be thrown for a loop, and you can get an exacerbation of scalp health issues, seborrheic dermatitis, alopecia areata can pop up. We're seeing an exacerbation of some of the scarring alopecias. So there's a lot of things that are going on, due to this, let's just say the cytokine storm, or this inflammatory response of the body, which is trying to fight off the virus.
Yeah, I have to say that, during this time, it's something probably that isn't in the head quite yet. Well, that's not a pun intended, but isn't right there, meaning you're more focused on the virus itself, you're more focused on health and safety, but this is an effect of poor health and something that should be addressed more.